All right. Good afternoon, everybody. Thanks so much for joining us today for From Crisis to Confidence, Mastering Event Response in Senior Living. My name's Shannon. I am a clinical risk manager with Care Agents by Specialty Insurance, and I will be moderating this presentation by Tony Malikdam, our Chief Risk Officer. So just a few housekeeping items before we get started. All attendees will remain on mute, please, throughout the presentation to ensure we can all have a successful webinar. If you have any questions or comments during the hour, please feel free to add them into the Q&A feature at any time, and we are going to try to answer as many as we can at the end of the presentation. At the conclusion, please help us out by filling out the short questionnaire so we can better serve you for future topics. And a link to the recording and the slides will be sent out to all attendees at the conclusion of the webinar. For any nursing home administrators out there looking for continuing education credit, we will file your attendance for credit with NAB, and those certificates will be sent to you for your attendance. We want to remind you that this webinar is for informational purposes only and does not constitute legal advice. Please consult with a qualified attorney for advice specific to your situation. We are speaking from a risk management perspective only today. So for those of you who are unfamiliar or new to Care Agents, we are a liability insurer focusing on skilled nursing and senior living, including assisted living and CCRCs. We work with operators big and small, single site, multi-site. The Care Agents Risk Management Program offers on-site risk assessments with with a member of our risk management team, education like today, our quarterly webinars. We are developing a repository of guides, tools, templates, and we are always available for risk management support should you need it. We also have technology partners, and together we provide access to falls and wound management solutions. Wound Rounds is a mobile wound care and documentation system that improves outcomes and reduces liability. And our other partner is VirtueSense, who offers an alert system that uses AI and machine vision to identify a resident's intent to get out of a bed or chair, hopefully giving you 30 to 65 seconds before they actually do. And this can reduce fall rates up to 80%. If you have any questions or interest in our program, you can use that email right there. You can always find our website and learn more there. So our risk management team we offer extensive experience in senior living. I have a clinical foundation in occupational therapy and a master's in public health. I like to think I bring a unique blend of analytical insight and hands-on experience to my risk management approach. Tony has a unique career path that has equipped her with a holistic understanding of the senior living industry. She started as a social worker in a nursing home, eventually rising to the position of administrator. Years later, she transitioned into the insurance field where she leveraged her firsthand knowledge of senior living operations to provide consultation and support her clients. Her background as a social worker and administrator with the risk management lens gives her a unique position to discuss today's topic. So, Tony, I will hand it over to you.
Okay, well, thanks so much. Thanks everybody for joining today. We'll just dive right in. We have a couple learning objectives today, which include defining harm in senior living and explaining the factors that make litigation and the regulatory scrutiny likely. Our second is to hopefully implement proactive strategies such as clear documentation, timely communication, effective customer service, transparent disclosure practices, and targeted staff training, all geared at reducing legal and regulatory risks. And our third objective is to evaluate, early resolution pathways, including apology and disclosure follow-up, and determine when these approaches improve outcomes for residents, families, and your organization. So as I mentioned, our first objective is really to define harm events. We'll move on and do just that. So what is a harm event? For today's topic, we're going to define that and use this term or terms throughout the presentation. So a harm event is, in senior living, is a major resident event that includes some sort of injury, and it did not necessarily occur due to the natural progression of a resident's disease process or their health status. So the harm event includes an outcome with some sort of impairment, either of the body structure or function, some sort of suffering, disability, possibly even death. It can be physical, psychological, or social. And many believe that harm events in senior living facilities or communities are considered preventable through appropriate care and safety measures. When thinking of examples of harm events, we're really not talking about a resident who may have been on hospice for 5 months with a chronic or progressive disease, eventually, passing away. We're talking about other examples that may include a fall with a fracture, sus substantiated abuse or neglect by a staff member to a resident, an acquired pressure injury, choking with death, elopement with hospitalization or death, medication error resulting in significant injury. Really, we can kind of go on and on with the list, but you get the idea in terms of those examples, I'm sure. So, are all harm events preventable? Probably not, but the perception of the public and your customers is that those events are likely preventable. Likely there are system failures that may play into, the cause or the event and may not be directly related to the specific staff member's care that was provided. And so, do all harm events point to poor care and negligence? The answer is no, but again, the perception is often the opposite. So let's talk about the regulatory scrutiny and litigation. Um, Really, long-term care has a negative perception in the eye of the public. Nursing homes and other levels of care in senior living are usually seen as the last place that one wants to go to live or receive care or spend any of their days in their older age. It's often seen as the lowest level of care, last choice, and overall just not positive. Even though for those of us who work in the field, we know that that's not the case at all. We know that many residents receive critical and essential care within the senior living industry. The public perception really continues to be a barrier in various ways, impacting customer service, customer satisfaction, really word of mouth, complaint surveys to the state, negatively impacting marketing and growing your census and brand, as well as the potential for litigation. Think about all of the, billboards and commercials asking the public if their loved one has been harmed in a nursing home, or you see negative stories in the media, and those can really shape and do shape the public's opinion, leading to heightened expectations for care standards. So not only are we fighting the public perception, but the whole of long-term care is up against increased regulations at the local, state, and federal levels with little support from many of those same agencies. I know that's not news to you, but these, communities are really required to meet strict guidelines and keep up with the ever-changing landscape of those new regulations, which are popping up or changing all the time. Senior living is really held to a very high standard as we're caring for people. I'll continue this kind of same topic here as with many residents and family members having unrealistic expectations of what care looks like in this setting. It may set the tone for future discontent and really tee up the next steps for litigation. Remember that many individuals that come into the long-term care arena have never experienced senior living before. They don't know what to expect. They only have their preconceived notions sometimes and what that tells them and what the public has portrayed, leading to, develop their views and expectations. So, fighting the negative widespread public view, many residents, family members have undesirable feelings coupled with guilt of not being able to care for a loved one at home. So, that feeling of responsibility and even remorse usually stays with them. And I've seen this play out in many times in my own practice as a nursing home administrator and as a risk manager, whether reviewing practices, programs, and even lawsuits and claims. But after a harm event, often family members feel they must advocate for their loved one or on their behalf. And so pursuing a lawsuit or filing an official complaint gives them kind of one avenue that they feel like they in fact have advocated and did what their loved one deserves, feeling heard or validated in some way in that process. So the feeling of guilt and loss really is significant and often not dealt with gracefully. I'm sure many of you have seen that in your own practice, but these emotions of guilt, frustration, and grief can surface as anger or mistrust towards caregivers and management. So in senior living, we really find ourselves in the relationship business. We are creating, maintaining, fostering, trusting relationships with the focus on communication, along with providing healthcare, caring for people, trying to ensure that residents obtain the highest level of well-being. I'm going to move on to our second objective, which will be a good portion of the discussion today. But just remember that we are talking about harm events today and what happened next. What happens next? The harm event, along with the followed up actions or interactions that occur after that harm event, all matter. They may make the difference whether that harm event then is followed by poor customers, satisfaction and feedback, complaint surveys, resident discharge or, not returning to your community, pursuing litigation, or on the other hand, a more favorable outcome, which may include understanding or effective communication, collaboration in terms of the resident's plan of care, which may lead to increased trust and a more significant ongoing relationship. So for our second objective today, I hope that you'll walk away with some proactive strategies to really reduce legal and regulatory risks. We'll touch on the importance of clear documentation, timely communication, effective customer service strategies, transparent disclosure practices, and targeted staff training. So let's talk about documentation first. The most important pieces are including, making sure your documentation is clear and concise, recording only the facts at the time, only what you observed, measured, assessed. You want to include the date and time and the location. Documenting as soon as possible after the harm event to ensure you can document the most accurate facts. The more time that passes, the higher the likelihood of less accurate timeline or facts or factual occurrence might be documented there. So describe the event using precise language, avoiding subjective information. I know that's hard, but we want to avoid documenting feelings, blame, opinions. You want to note the name, roles, and contact information of residents, staff, and witnesses only in the investigation section of your documentation. You can include quotes if relevant to the event. I encourage you to document all immediate interventions, treatments, or actions that were taken. Record all notifications to the physician, any other healthcare providers, as well as family members with names and roles, such as power of attorney or attending physician. You should include the date and time that you attempted to contact those individuals. If there are multiple attempts, document that multiple times with any details on any sort of messages that were left for those individuals. Describe any physical harm, injury, or damage to equipment. Document the resident's condition and how it changed after the event. You want to make sure that you're documenting and updating the resident's plan of care based on the event and its outcomes to include specific actionable interventions if they apply. There's lots to discuss when it comes to documentation to avoid, but I will stick to a few quick tips, if you will. You want to avoid internal references. So don't reference your incident report in your progress note, your nursing progress note, or other documentation within the resident's record. Keep the investigation separate from the incident report. This documentation should all be done in the incident report and investigation, which should have quality assurance and performance improvement protections with confidential language and proactive language noted on the document or the system that you're using. So you do want to make sure that you have that language kind of posted all over your copy documents. Um, they're meant for, again, that quality assurance and performance improvement and should be separate from the residence record. You do want to avoid subjective language, including personal beliefs and speculation. For example, saying I think or documenting supposed to or likely. Um, that's leading to speculation. It doesn't sound factual. Avoid late entries whenever possible, as they can create a negative impression. If necessary and you need to document that late entry, follow your community's policy for late entries. If you don't have one, you might want to make sure that you consider, working with your C-suite or whoever writes your policies, your director of risk management to come up with a documentation policy. You want to avoid jousting at your coworkers and colleagues in the record. Remember to document system factors that may have contributed to the harm event, not just the actions of a particular person. One of the key moments after a harm event includes timely communication to residents, families, and decision makers. It may be one of the most important pieces, actually. After a significant or harm event, staff may instinctively want to avoid those difficult conversations with family members or the residents themselves. However, avoiding communication really is one of the greatest mistakes providers can make. It can just erode trust and increase the risk of conflict. So, timely, transparent, empathetic outreach is essential. You maybe will hear me say empathetic communication or empathy a number of times throughout the presentation, but that's because it really is so important. So you should really decide who will lead the conversation with family members or the resident, after a harm event. Be sure that the champion of that communication process has gathered accurate facts prior to the conversation. You want to communicate in a private and respectful way, communicate the facts clearly, share updates about the resident's condition, and explain why changes in the plan of care um, may need to happen and how the resident's needs will now be met if appropriate. You want to stick to the facts that are known at the time. I may have said this earlier, but avoid speculation and blaming others. Include regret for the harm that's occurred and invite questions. Acknowledge the question immediately and directly. This level of openness really demonstrates integrity, helps prevent misunderstanding, and can, that would may otherwise escalate it into conflict or even litigation. Let's talk a little bit more specifically about questions that may have come up or may come up in this process. Going back to questions from residents and family members, really, it's important to keep in mind that tough questions usually include major emotions, and that an appropriate and truthful response may not necessarily fulfill the resident or family member's, response and what they're looking for. Let's discuss some questions that might come up in possible ways for that communication champion or specific individual to respond. Keep in mind that this is not an all-inclusive list. It just provides some example responses. May not be the only way to respond effectively, but again, just some examples. So common questions may include asking who is to blame. It is best for that communication specialist, that leader, to let the person know that your organization will be working through the investigation and will share results of the event as soon as they or you are able. You may also want to share that most of the events have multiple factors that may have contributed to them, which can include a mixture of human and system components. Another question might be, can I see a copy of the incident report or investigation? The communicator really should balance transparency with a need to also maintain some information as confidential. So the leader or the champion here should be able to know what your designated communities' policy is on sharing incident reports and investigation documents before responding to the question. You don't want to risk inadvertently waiving quality improvement and peer review privileges. And so, you know, it's a tricky question, but making sure that you're using your empathy to maintain as much of that trusting relationship as you can. So who's going to pay for this? That's another question that might come up after a harm event. It's usually best to defer all conversations about financial resolution to the appropriate personnel and not overpromise if, your organization or community is not prepared to compensate. And another question might include who's going to be reprimanded, who's going to be fired, who's going to be held accountable. This question usually really is because someone's asking, are you taking this seriously? And so the communication champion should acknowledge the issue and redirect the conversation to realizing that your community, as well as the resident and family member, have the same goals, which is to ensure that it doesn't happen to anyone else in terms of that harm event that occurred. Let's talk about effective customer service, which is really another strategy. And really, customer service boils down to communication and timely follow-up. So tell the family that you will be following up after the investigation is complete. I know we mentioned that earlier, but you need to do just that. Once you say you will follow up, it really feels as if a promise has been made to that resident or family members or decision maker. Even if you don't have all the facts, an update about the ongoing investigation can be helpful. Keeping individuals in the know really ensures that they are not left, wondering if you care or if you're making the resident a priority or their loved one a priority. Provide updates and results of the investigation whenever possible. Explain what steps the community will take to prevent recurrence based on your investigation findings. Focus on what will be done to minimize the effects of harm and to ensure the residents' highest quality of life is the focus. Throughout, all the communication that you have, again, be empathetic, acknowledging and validating the feelings of the resident and family members, maintain a patient-centered focus, making sure that the residents' needs and their well-being is at the forefront. You should also try to understand that this process is not just a single conversation, but may be an ongoing process. Might be multiple meetings or conversations, starting with the initial disclosure of the harm event, more information communicated about the investigation and implementation of various changes. So the identified leader or champion should be tasked with the communication and the follow-up to the residents' family members and really should understand the importance of the timeliness, following up when you said you would, empathy, and being factual all along the way. Let's talk a little bit about transparent disclosure practices. This is really about building a culture of communication and accountability. Take a look at what your community really has in place now. So you may want to develop an organizational policy that guides staff on communicating effectively and appropriately overall, as well as when a harm event occurs, if you don't have one in place already. One way to ensure that you have transparent disclosure practices is to set the tone up front before any such harm event occurs. Include timely and regular updates on the resident's health, status, treatment, medications, whatever it may be, but regularly, throughout their stay. So involve residents and their family members or decision makers in care planning sessions, showing that you value their input, that there are partners in the care. They likely will feel heard when included. Encourage two-way communication, establishing some sort of mechanism for residents and family members to provide feedback, ask questions, and voice concerns. There's lots of examples for that. I'm sure most of you do have a resident council, could be a family council, satisfaction surveys, compliance hotline, any sort of open forum, lots of ideas there. If there is a harm event, practice open disclosure, including an apology if your organization allows, which we'll talk more about shortly. and explain what happened and investigate as previously mentioned. And again, communicate next steps to prevent that reoccurrence. Senior living is both a healthcare and hospitality business rooted in compassion, trust, and communication. Embedding these principles in every interaction will not only strengthen relationships, but also protect your organization's reputation and integrity. Let's talk about staff training. So, following your organizational policy on communication after a harm event, really want to spend time training managers and new team members using real world examples and role playing with various exercises, including who should lead the harm event disclosure conversations. This training should occur proactively again throughout the year before the harm event occurs. So staff and community leaders are really prepared and know what steps to take when a harm event actually does occur. After a harm event and follow-up actions are completed, include documentation, communication, and disclosure. Debrief and discuss, you know, what situation happened, where communication may have been handled better, and identify any improvement strategies for the future. You really can include this information and discussion in your monthly or quarterly QAPI committee meetings if you have them. Let's talk about our third objective here. We're going to talk more specifically about the early resolution pathways. There likely will be a time when really there was, in fact, some culpability on the part of the senior living community. As we know, not everyone is perfect. Not every, all systems are not flawless. During these times, your organization should be thinking ahead of how they will handle these instances. So I will provide some examples and possible strategies, but please remember that your organization should be speaking with about your policies, your procedures, your protocols, and the thought processes around these sensitive subjects. You may want to have this as even a step number one when planning for, preparing for a harm event follow-up. We want to identify these approaches and that can help improve outcomes for residents, family members, and your organization. An early resolution pathway in senior living after a harm event is really a process that prioritizes immediate and transparent communication, investigation, and possibly include fair compensation with residents and their families. It differs from really traditional adversarial approaches by aiming for collaborative and timely resolution that focuses on systematic um, improvements to really prevent future harm, support caregivers, and meet the needs of those that have been impacted. This can be an area where you consider implementing an arbitration agreement for residents upon admission to your community, if allowed by your state laws. I'll not really focus on that topic today, but happy to discuss arbitration agreements further. So if you are a client of ours, feel free to reach out anytime. We're happy to talk more about that topic. The communication to the residents and family members should include what happened, why it happened, and what's being done about it. Remember, which may include multiple conversations. The process, depending on your organization's policy, may include fair compensation after the harm event, which may be a faster, more productive process than traditional legal processes. When there is some sort of culpability or poor defensive strategies in place that might make more sense to offer that compensation. The process is meant to be collaborative and to keep residents and family members involved, allowing them to participate in the resolution and ensure their needs for explanations and support are addressed. The overarching goal of the early resolution pathway is to move away from a culture of denial and toward one of transparency, accountability, and continuous improvement. By working collaboratively with residents and family members, senior living communities can respond to harm events in a way that promotes healing, fosters trust, and ultimately leads to a safer, community and care for everyone. Let's talk a little bit more specifically about apologies. Apologies really can play a powerful role in maintaining relationships and preventing escalation. So when delivered appropriately, they can improve satisfaction, can, you know, um, reduce anger, foster reconciliation, all without admitting legal fault. Apologies can strengthen trust and reduce litigation in a few different ways. By escalating emotional conflict. A sincere apology, de-escalating, excuse me, emotional conflict. A sincere apology acknowledges the family's pain and validates their emotions. Signaling accountability. Expressing regret and explaining how the error occurred can demonstrate fairness and transparency. It can help by rebuilding trust. Honest, empathetic communication helps families feel respected, included, and more willing to collaborate. It can also help by supporting, excuse me, resolution. Apologies can often, you know, help open communication pathways during mediation or other dispute resolution processes. So again, apologies can be important, but before deciding on organizational stances on apologies, you might want to consider what your state laws may say about it. Many states have enacted apology laws that allow providers to express sympathy without fear of those statements being used as evidence or liability. On the other hand, some laws, protect only expressions of empathy, like saying, I'm sorry, while others may protect admissions of fault. I made a mistake. So understanding your state's specific apology protections is essential really before developing an internal approach. So I really recommend you consult with your legal counsel, general counsel, if you have a defense firm you work with, just to make sure that you are in line with what what will make sense for you moving forward. So how to deliver an effective and safe apology. The first is really to say I'm sorry, but to be sincere, to be empathetic. We want to be taking responsibility where appropriate, but same thing we're saying all along, which is really state the facts, offer a plan for correction or prevention for the future. Um, you do want to express empathy carefully. So avoid language that implies legal fault unless that has been advised by your legal counsel. But offer support, follow up, and specific resource person really to connect with for further questions, whether it's that same contact from the beginning or someone else. I do want to give a couple examples of, post-harm event and some of the follow-up and results of each of the situations. So I believe I have three here. The first example involves a skilled nursing resident that was sent to the hospital after significant pain and swelling. Later was diagnosed with internal fixation of the patella. The resident was actually bedbound with some contractures and has required total care and has been in that kind of state for quite some time. Family was very involved and usually visited multiple times a week. The family was not notified about the resident being sent to the hospital. They did not receive any information about the incident or the health status after being diagnosed with the fracture. Family members, tried to come for a visit, and when they arrived, the resident was not in the community, still in the hospital. They were very upset. Immediately came up with multiple questions about why they were not notified, what happened, who did it, lots of blaming, feeling that they were being deceived and information was being concealed. So a delay or lack of communication about this event. So no follow-up from leadership about the investigation, no communication discussing the residents, comorbidities, the possible causes or factors that may have impacted the resident's injury according to the physician's notes from the hospital. Really nothing was communicated. So no one took any sort of accountability. Doesn't even sound like there was any empathy that was provided in any of those, or the lack of interactions, I should say. Likely the family did not feel their loved one nor his health was important to the community. They didn't feel heard, respected, or significant really in any way. They pursued a lawsuit. It, in fact, did settle for over $375,000. Let's talk about the case example number two. An assisted living resident fell in the middle of the night, was sent to the hospital, diagnosed with a hip fracture. The floor nurse or the nurse who was working with that resident during the night called the family to inform them of the fall and the ER transfer. When asked what happened, the nurse proceeded to blame the resident and said that if she, the resident, would have just listened to the staff's directions, she would not be in this predicament. Clearly, no empathy, no understanding, not even sympathy. There was no follow-up from any sort of leadership. Um, Family was clearly upset. Resident was upset that she had the incident. A complaint survey was received with deficiencies from the state. As you might know, many of those deficiencies are in complaint surveys or survey findings or inspection findings are made public. A lawsuit followed. That deficiency did not play well for that lawsuit. That lawsuit settled for over $300,000. I'll give a third example here with a little bit different of an outcome. Um, Skilled nursing community, a resident actually eloped in the middle of the day. She was wheelchair bound, but used a motorized wheelchair, and she's able to ambulate, using that. She actually followed a visitor out of the front door at a very busy time at the reception desk. She was found by the local fire department a few blocks away after tumbling out of her wheelchair onto the sidewalk. She was returned to the nursing home after being evaluated and treated for a femur fracture. In this case, the social service director was the one that was tasked with communicating um, basically the details of the harm event and communicating with the family. The social service director immediately called the resident's healthcare power of attorney and reported the suspected elopement. Before even considering the resident was located, the elopement was communicated to the family. The social service director asked for any information about the resident's places that she liked to frequent, special likes, dislikes, and any additional information that might lead them to successfully and safely return that resident. Social service director was able to inform the family of what steps had been taken thus far to locate the resident, which included reporting situation to the police, staff systematically scouring the facility, and checking the surrounding area, within the community. There were promises made for an update within 2 hours. The social service director did, in fact, call back within 2 hours and was able to provide information about the residents, being admitted to the hospital. Promises were made to follow up later on in the day on any updates they heard from the hospital. Then the social service director was able to communicate and inform about the femur fracture, and then also provided information from the resident on what she said happened, even though she was only alert and oriented to person. The social service director said that she would communicate with her team and leadership internally to finish up the full investigation internally and get back to her with more information about what happened. So she also communicated the ways that they were going to keep the residents safe from here on out, which included applying a WanderGuard bracelet, checking all WanderGuard door systems to ensure that they're all in working order, providing staff education about the residents' elopement and exit seeking behavior. So informing all the staff that she is an elopement risk. Social service director then followed up the next day with more information about the results of the investigation. There, she was able to sincerely apologize for the incident and the fact that the resident was now healing from a femur fracture, but expressed, the focus on her care and pain level and wanted to ensure that she healed properly and quickly. The social service director was able to share that the lapses in their system and facility included the fact that the receptionist left at 5 p.m. when the nurse on the floor was still completing a medication pass, and was not really able to help monitor the front door properly. The camera showed a family member opening the coded door for the resident to exit. So the solutions and interventions that were put in place included extending the hours at the reception desk, additional 3 hours per evening, changing the code at the front desk, and educating staff that they should not share the code with any visitors. The staff had to let visitors out after 8 p.m. When the receptionist has left for the day. So the social service director ended the conversation with asking if the resident's family member had any questions, had any further concerns or suggestions. And in this particular case, no legal ramifications came from this incident. No complaints or concerns filed with the state regulator. So in this case, although there was a harm event, there was no consequences after that other than, dealing with the resident's particular pain and healing. I'm sure you all can think of other examples in your own experience and your work at your senior living community that you work at or help oversee. So I'm sure you can, chime in with your own examples. At this time, I would encourage you to submit any questions or comments you might have in the Q&A feature. Also, as a reminder, please help us out by filling out the brief survey at the end of that will pop up at the end of the webinar. That'll just help us provide feedback and suggestions on topics that you might like to hear about in the future. And as Shannon said earlier, a link to the recording and the slides will be sent out to all attendees at the conclusion, and we will file for your CEs if necessary. So I can pass it back to Shannon and she can let us know if anybody has any particular questions.
Yeah, we actually got a few really good questions. And I just wanted to say if you forgot or didn't put your NAB ID in the registration, just send me an email, srose@kbspecialtyinsurance.com, or is Tony's email on here? Tony's email, and just provide that to us, and we're happy to submit it. So here's some questions. So what would you do when a family member demands to see video footage of an event that may have happened in the hallway?
Hmm, that's a good question. So the video footage would likely be treated just like an incident report, or, that investigation document or, piece of quality protected information. So it's important before you respond, you would want to know what your policy is on sharing that information. You don't want to certainly sound like you're trying to hide any information, but sometimes saying that it's not within our policy to, share that with outsiders outside the um, organization sometimes can be good enough. If you do want to share it, if it's something that you think it would be helpful and what's in your policy to share, I think that could be a good thing. But a lot of times, again, you want to leave that video footage for your investigation. You want to leave it quality protected. You want to ensure it stays privileged should there be a lawsuit or a claim that is pursued. So treating it just like an incident report, saying that we don't, share that information, that you would be glad to give a synopsis of what you saw or what happened once you complete your full investigation. So hopefully that answered your question.
I think so, yeah. Privileged, protected, confidential.
Yes,
I like it.
absolutely.
Um, Here's another one. What if the harm event happens in the middle of the night? I always say too, like elopements are going to happen at 4 a.m., right?
Mhm.
So do you suggest having a specific leader follow up immediately, or is the next morning okay?
Yeah, that's a good question. Whenever we have something occur, it's never at a convenient time when all the management is there in the building usually, right? So if I'm not sure if we have any nurses that work the floor listening in today, but if you are going to have somebody who's a frontline staff member informing or being that initial communicator about the event, which, it's better to communicate timely rather than wait. So the initial communication may come from that nurse who's working the floor. But again, it kind of goes back to the staff training, I think, when you think about communicating with empathy, communicating, oh gosh, sorry that happened today. I'm not sure if I have all the facts, but your loved one did experience a fall with a fracture, or your, loved one did have, whatever the incident may be. But the idea is communicating that with empathy and remembering to communicate the facts. If that frontline staff member is the initial person to disclose the harm or the event, I think it is essential that you have an identified communication specialist or champion, whether that's the administrator, the director of nursing, the risk person, whoever it is you identify, to follow up and just, make the point of contact. So then you can be the one that's going to communicate all along the way, some of the same things we talked about, which was, you know, what happened, how it happened, what you're going to do to prevent reoccurrence, what are you doing to keep the residents safe from here on out, how are you keeping them comfortable? All of those pieces I think are important. So if you follow up the next morning, that might be fine from a supervisor standpoint, but the staff that respond initially to inform about the harm event should be trained in, think about the example I gave where when the nurse called after a fall in the assisted living where that nurse was, blaming the resident, which maybe it was the resident's fault, and maybe the resident did have, was being stubborn, but it's never good to hear that from the other side. So training staff on the proper way to communicate can be really helpful. Hopefully that was.
Yeah, yeah. I also think that, some administrators out there just they want to be called, right? At
Mm,
2 a.m. Like they're,
amazing.
yeah, call me anytime. And
Hmm.
just to be that support person,
Yeah,
especially if it, ends up being a frontline staff member, sort of going through those steps.
yeah.
So if you're an administrator and that's your preference,
Hmm.
add that to the protocol.
Yeah, absolutely.
Here's another one. When financial compensation is considered, how would you offer it without offending the resident and or maybe the family?
Mm-hmm. Yeah, so I think, the compensation is really a tricky subject matter to really tread around lightly. So first of all, you need to know what your policy for your organization is on compensating financially. If you're not sure, then you want to defer that to the appropriate person who's going to be able to speak to that matter. Um, but sometimes, as an administrator, director of nursing, or leader in the community, the health and wellness director, you might be in a position where you can offer things like, maybe you had gosh forbid, you had a resident death that was unexpected. Sometimes just offering to pay for your cremation or funeral services might go a long way. And communicating it in a way or offering it in a way that you're hoping takes some sort of stress or pressure from the family member. So, if you had an unexpected death and the family seems to be upset and is asking about financial compensation, or even dancing around the subject matter, you might say, I'm so sorry you went through this. I can't imagine being in your shoes, but we would love to be able to take a little bit of stress or you know taxing area away from you by offering to take care of the medical expenses, the funeral, the cremation, something of that matter. You may even want to offer, if there was a balance for room and board, for example. Maybe that's something that your community be willing to take care of. Again, kind of alleviating some level of stress. It's not going to, take care of everything, but just to let that resident, that family, whoever it is, know that, you're happy to try to work with them and you realize that this is a tough time that they might be going through, especially if it involves a death. Um, but you want to do it in a way that doesn't necessarily say that you're taking all the blame. So it can be a very touchy subject matter. I would recommend if there is money involved that you consult with again, your defense firm, your general counsel to how to see how you'd approach it. But generally, if you know what you can and cannot offer up front, sometimes that can be helpful in the moment to be able to make those offers. Yeah, hopefully
Okay.
that was helpful.
Yeah, I like that risk strategy. Um, I just want to answer. So the link and the slides will be sent out after this, and we also have a YouTube channel.
Mm,
If you go to Roosevelt Road, I think if you look for care agents, KMB Specialty, our parent organization is Roosevelt Road, and they have a YouTube channel. All of our webinars are going up there. We have, clips and other things from conferences and things like that. But we plan on housing our webinars there. And I think that they can be good training tools too. So if you want to, when this one pops up, you could, show to your staff, show to your team as a training. I think that answered that question. And then it looks like there's two more good questions I see. In your experience, what communication missteps most often damage trust after an event?
yeah. I think the biggest thing, and this is from my own experiences, is really has to do with a delay. We think that we're trying to get all of the information gathered and get all the, reasons and get all of the information before we initially reach out. So the delay in communication, I think that's a huge misstep. It's okay to call to say, "I'm sorry this happened to your loved one. We are really looking into it right now. We have to do a full investigation. We're taking this very seriously." Just to give them an update of, we know it happened, we're looking into it, and your loved one is still important to us. So I think the timeliness of that initial communication is so important. Even when the harm event is something, small. If somebody, fractured their wrist, maybe that doesn't sound so bad, but that could be really severe to that family member, so, those small harm events all the way up to something that might be bigger of like unexpected death or an elopement and someone passed. I mean, the timeliness of that initial reach out is so important. And then follow through throughout, the process of communication. If you say you're going to call them back by the end of the day, you need to call them back by the end of the day. Even if you say, "I don't still have all the answers, but I wanted to give you an update that we're still working on it." And then you keep that communication going. Let them know that you're not shying away from it. When you avoid the communication or you wait for all the facts, it can be really hard because if they haven't heard from you and it's been 48 hours, it didn't look so great. It looks like you were trying to figure out how to come up with a maybe a lie, right? How to come up with a plan to really explain what happened when it's okay to say we don't know everything right now. We're figuring it out, but I want you to know that we're working on it. It's important to us. Hopefully that helps. I'm sure there are lots of other missteps, but I think not ensuring that you have properly trained staff. So, if the initial staff that are communicating the harm event um, are sharing information like, "Well, she fell because we are short-staffed," or, "I don't know what happened on the night shift. I only worked the day shift," things that might throw each other under the bus. It's not helpful for that loved one to hear. It's not helpful for the community. It's not helpful for the resident. So helping staff understand, how to communicate properly and what they can be saying. And if they feel cornered, kind of mentioning some of those role playing opportunities can be so helpful. Sometimes family members are angry. They are accusatory, and staff might feel backed into a corner. And so, saying some things that may not be helpful can be very problematic. Once you say it, it's hard to take it back, right? So, providing as much education as you can up front. You don't have to call it, you can call the training whatever you want when you think about customer service training, service recovery. It can be anything like that, but it really should be spent on time. If the nurses are the ones that are making some of those initial calls, or the department managers, or the med techs, or whoever you have on staff, make sure they're included in that training. So, touching on a couple different things, but yeah.
Okay. Yeah, it's okay to say, I don't know, period. Like, you
Hmm.
don't have to say, I don't know because,
Yeah,
no, period.
yeah,
Okay.
exactly. Yep.
Um, one more, and I think this sort of piggybacks off of it, but what would you say is the most important first step for a facility, a community that knows their event response practices need improvement, but they're just not sure where to begin? So maybe is
Mm.
it that training? Is it that, what would you say?
Yeah, I think a lot of times you want to make sure that your policy or your unwritten protocol will guide those practices. So determining how you're going to approach things as an organization will be, I think, kind of the first step. And then your training should follow along with that, right? But, when you think about who's going to communicate harm events, how quickly are we going to do it? It doesn't have to be all within your written policy step by step, but generally you should have a protocol and your management should be aware of what that protocol is so that, anytime they're asked, they quickly know, yes, we notify within the hour about the harm event once we've been made aware or whatever those protocols are. But I think it's just so important to think about things like, are you going to allow your staff to um, provide a verbal apology? Is the organization going to have a written apology? Are you going to allow for financial compensation? Who's allowed to provide that? Is it just the administrator? Is it the director of risk management at a corporate level? Kind of talking through some of those things. And if you don't know if you have those, this is the perfect time to go back to your organization and say, how do we handle these types of things? Because being hit with litigation down the line and paying $300,000 or your deductible or it's not great. I'm sure there's lots more you can buy and do for your community and your residents and staff with $300,000 or $100,000. You would hate to pay for it a lawsuit, but there are certainly ways to show that you care and you want to do the right thing and you want to make sure that you're following up and supporting your residents and family members. So yeah, I think it's about starting with your policy, your protocol, and then follow up with training to make sure everybody knows what they can do and what their role should be should a harm event occur.
So the first step really is to just have the conversation, with your management team. Like, what do we want to do, and then lay that
Mhm.
out. And yeah,
Yeah,
okay,
yeah.
all right, I like it. Anything else out there? Let me just double check. Oh, we're all good. All
Okay.
right, thank you, Tony. Great stuff.
Thanks everybody for joining. You'll receive all of our info and follow up as Shannon mentioned, and appreciate everybody's time today. Thanks so much.
Thanks, everybody.